Hello, I prevent friends and family. This is Allison, your friendly neighborhood peer prevention specialist. As December marks HIV and AIDS Awareness Month, we have prepared a special video that covers everything from prevention, treatment, transmission, disclosure, and more. Follow along and be sure to like our video, become a subscriber so you'll never miss a video from the prevention team here at Odyssey House, Louisiana. So, what is HIV? HIV is the human immunodeficiency virus. It is a virus that can get into your bloodstream and begin to replicate itself. As the name expresses, it attacks the body's immune system, making a person more vulnerable to other diseases and infections. The beginning stage is known as acute HIV infection. Symptoms of acute HIV infection vary, but most people report having flu-like symptoms and or a rash on their skin. In this stage, there is a high amount of HIV in a person's blood, and they are highly contagious. The second stage is called chronic HIV infection. Many people in this stage are asymptomatic, meaning they show no visible signs of infection. However, the virus is still transmissible. The third and final stage of an HIV infection is known as acquired immunodeficiency syndrome, or AIDS. It is important to note that HIV and AIDS are not the same. AIDS is not transmissible. A diagnosis of HIV is not a guaranteed diagnosis of AIDS further down the line. AIDS occurs when HIV goes untreated and the immune system is irrevocably damaged. It is a common misconception that a person can die from AIDS itself. With a weakened immune system, any opportunistic infection can lead to serious illness or even death. Examples of opportunistic infections could be pneumonia, tuberculosis, salmonella bacteria infection, or invasive cancers. HIV is spread through the exchange of four bodily fluids: semen, vaginal fluids, blood, and breast milk. There is some indication that the virus may be spread through rectal fluid as well, but that has not been made conclusive. What we can tell you for sure is that HIV is not transmissible through saliva or sweat. You cannot contract HIV from hugging or kissing. The most common way that HIV is spread is through unprotected sex, followed by the sharing of injection equipment for people who inject drugs. So, who is at risk? The answer is simple: anyone who engages in unprotected sexual activity. While there are many forms of contraception that protects against an unwanted pregnancy, condoms are the only form that protect against the spread of sexually transmitted infections, also known as STIs. Most people with an STI are asymptomatic. Condoms act as a barrier between skin on skin contact and the exchange of bodily fluids. There are condoms for oral sex too. These are called dental dams. Dental dams are thin layers of latex that can be placed over the genitals and anus before performing oral sex. Here at Prevention, we offer both condom kits with lubricant and dental dams for free to anyone who needs them. There are many myths and misconceptions surrounding HIV and AIDS. We are going to dispel some of those now. The first one is probably the most damaging. It was a strongly held belief that HIV and AIDS was a gay disease. Calling HIV a gay or LGBTQ plus disease is medically untrue and only serves to perpetuate harmful stereotypes about people living with HIV and members of the LGBTQ community. This stigma has caused people to not seek treatment for fear of being outed as a member of the LGBTQ plus community. This is an example of how stigma can cause real pain and suffering in disadvantaged communities. We cannot allow these harmful stereotypes to continue. Let's talk for a minute about how the language we use can also perpetuate stigma. For one, we should never disclose another person's status. For fear of violence and prejudices, Most people living and thriving with HIV choose not to disclose their status, as it is their right to do so. HIV is a life altering event. When a person chooses to disclose their status to us, we must be supportive of them. It is not our job to give medical advice or lifestyle opinions. It is our job to love them and treat them respectfully. As we discussed earlier, HIV is not a death sentence. According to the National Institute of Health, a major advance came in 1996 when researchers found that triple drug therapy could durably suppress HIV replication to minimal levels, while creating a high genetic barrier against development of drug resistance. This medication stopped the replication process of HIV in the blood, therefore lowering the amount of the virus present in the blood, known as the viral load. When taking this medication as prescribed by a doctor, a person's viral load can be lowered to the point where the virus is undetectable and untransmittable, commonly referred to as U equals U. In 2010, the National Institute of Allergy and Infectious Diseases supported a clinical trial called IPRIX. This study was the first to establish the effectiveness of PrEP. PrEP stands for pre exposure prophylaxis. The Oxford Dictionary defines prophylaxis as an action taken to prevent disease, especially by specified means or against a specified disease. PrEP is a pill that you can take daily to reduce the risk of HIV transmission. This involves an HIV negative person taking the pill to reduce the risk of contracting the virus. PrEP does not protect against other STIs or pregnancy. Studies have shown it has an efficacy rate of up to 90% through sex. Incredible. If you are interested in learning out more about PrEP or to see if PrEP is right for you, call our clinic at 504-383-8559 to schedule an appointment. We offer PrEP in pill form as well as a monthly injection. If you think you have been exposed to HIV, post exposure prophylaxis, PEP, may be an option within the first 42 to 78 hours after possible occurrence of exposure. Contact a healthcare provider or go to the nearest emergency room for access to PEP. The only way to know your status is to get tested. The CDC recommends everyone between the ages of 13 and 64 get tested every year, regardless of risk. Here at Odyssey House Prevention, we provide free, mobile, rapid HIV screenings to our New Orleans community. You can find out where we'll be every day by following us on Instagram at iprevent_OHL and iprevent_Odyssey House Louisiana on Facebook. Every Monday, we release an outreach tracker so you can keep up with where we'll be. We also provide our safe use syringe kits and Narcan for free to anyone who needs them. Call our office at 504-418-4955 and come by the office at 1125 North Tonty Street for all of your prevention needs. Thanks for tuning in, and we will see you next time.